Well, it's been 2 weeks since we had our last phone-in with Dr. Joseph Blondeau, and we're still in pretty much the same position we were then, still waiting for kids aged 5 to 11 to get the go-ahead to be vaccinated. And today on the program, we're going to talk about that. We're going to talk about COVID long haulers, and of course, we'll take your vaccine and COVID-related questions. Once again, today we're joined by Dr. Joseph Blondeau. He's head of microbiology at Saskatoon's Royal University Hospital and teaches about infectious disease at the University of Saskatchewan. A quick reminder here, Dr. Blondeau is not part of policy decisions made by the provincial government, but he is an expert when it comes to infectious disease. So if you have a question, give us a call. Right now, it's 1-800-716-2221. You can email bluesky@cbc.ca, tweet us at blueskycbc. And we are also live streaming this program on our CBC Saskatchewan and Saskatoon Facebook pages. You can ask your question in the comments section, and we'll try to get to them as quickly as we can. Again, we're very grateful. Dr. Blondeau is spending the noon hour with us again today. Good afternoon, Dr. Blondeau.
Hey, Garth, how you doing?
I'm well. Thanks again for your time today.
Oh, it's my pleasure. Thanks for asking me one more time to come on.
Okay, it's been
one of these days you'll stop having me on, and maybe that'll mean that the pandemic is coming to an end, and that'll be good for everybody.
Well, I think that day we're going to have lunch.
Oh, we sure are.
All right.
And a good stiff drink, I think, too. So.
It's been weeks since the FDA authorized COVID vaccine for kids ages 5 to 11. Here in Canada, it's going to be another week or two. Any idea why it's taking so long?
Canada has its own very, very detailed review process where they don't just simply go based on what somebody else has approved. They want to look through the data and make sure it fits in with what our expert working groups are looking for, not only in terms of efficacy, Garth, but also in terms of safety. So I think that the good thing is that we have such a detailed review process that ensures that medicines that are coming to market are, to the best of everybody's abilities, deemed to be safe. I'm not saying that the Americans are any the less diligent in scrutinizing that data, but I think that the difference might have been that probably the documentation was in front of the Americans a little sooner than it was in front of Canada, and that lag is probably related to that. But I actually expect that Canada will approve this vaccine in the coming days or week or two. And from my reading of what I'm seeing in the literature, vaccines ready to be shipped, if it's not already shipped.
So what would Health Canada be reviewing at this point?
Well, so they want to review all of the efficacy data, and because there were a couple of different ways in which the vaccine was investigated in kids. There was some dosage investigation, so a dosage which was a partial dosage of what was given to adults. And in addition to looking to see about prevention of COVID infections, they're also looking at neutralizing antibody. And so there's 2 or 3 components there that they want to look at, and they want to make sure that there's no safety concerns that were seen in children that were not seen in adults, and whether or not that could be an indication of potential problem in children. And as to my reading of what's available, which is not a lot, there didn't appear to be any safety concerns in children that were not, or side effects, for example, that were not seen in adults. So unless there's something in there that the public, including myself, haven't had a look at, I fully expect it'll be approved.
And for adult vaccinations now, are we still looking at a minimum of a 6-week gap between first and second dose?
No, you don't have to anymore. In the beginning, when we had that separation, it was really because it was designed to try and get more first dose vaccines into arms. So that separation was extended not only from 6 weeks out, as you know, to 3 months, but now the period between first and second doses is around 28 days, give or take a day. And if you were naturally infected with COVID and then want to get vaccinated, I think you only have to wait 10 days now before you can start your vaccine program or your immunization program. And then, of course, that leads in then, Garth, to the booster doses, since that's going to be a question. Mm-hmm. And as you know, individuals that are deemed at risk are already eligible for a booster dose, and then others are slowly coming online. So I fit in, for example, as one of the healthcare workers, and for me, it has to be 6 months after my last dose. When I'm eligible to receive the booster dose. And now that there has been a national recommendation in favor of booster doses, I actually see that this is likely to be expanded to the broader population and not just subgroups within the population.
Where did those recommendations stand on those people early on who got 2 doses of AstraZeneca?
Well, so if you've had AstraZeneca, and this has created a concern for you in regards to travel, because there's still some countries that don't necessarily recognize either the AstraZeneca, or if you've had a mixture of vaccines, then an individual can go and be vaccinated with an mRNA vaccine.
Okay, but is that only for travel or anybody who's received 2 doses of
No,
AstraZeneca?
I don't think it's exclusively for travel, Garth.
Okay. And we're going to go to the phone lines right away, but I've probably asked you this question before, but I'm going to ask you again because we get this question over and over again. You know, when you look at the little pie chart of infections,
Yep.
you know, by far and away the majority are unvaccinated, okay?
Yep.
But the next largest group, and we're talking about 24 to 28%, are amongst the fully vaccinated. And you can see where that raises a lot of questions.
Yeah, so I've got the Canadian national data up on my computer, Garth, looking at cases. And if you look at the overall number of cases, 82.2% occurred in unvaccinated, 5% in those that were not yet protected, about 6% in those that were partially protected, and about 6.9% in fully vaccinated. And then you can look at hospitalizations and deaths, and it follows a similar trend. So what does that mean? It means that if you're unvaccinated, you are the lion's share of the cases that are occurring in this fourth wave. But there's also a number of cases that are occurring within those that are not yet fully protected or those that are partially vaccinated, and that was to be expected as well. I think where people are getting probably the most concerned is what's happened in those individuals that are fully vaccinated. Mm-hmm. And we know, and we've talked about this before, that the vaccines are not 100% efficacious. But we do know that if you're fully vaccinated and you get exposed to the virus, you're more likely to have a milder infection. Now, where that changes is if you happen to be an older individual, so you're over 65, and if you have comorbidities, then the possibility that you could have a more significant infection, even if you're double vaccinated, is higher than, say, in a younger individual who's double vaccinated and without comorbidities. So that data set has been seen in this country, and there's an awfully large database in the United States showing the exact same thing. And so those out there that say, see, the vaccines don't work, that is simply not true. The vaccines do work, but they're not perfect and they're not 100%. And that is how the data actually breaks down from a national point of view.
Okay, let's go to the phone line. Keith has been waiting in Saskatoon. Hi, Keith.
Hi there. I just kind of had a comment, and maybe I'll get some feedback. I noticed that the numbers that are being reported since the self-tests came out, the lineups have disappeared, and the number of cases have dropped significantly, like by thousands. But the death count pretty much is the same. And I personally know 2 families that were both anti-vax families. They got the self-test kits. Everybody tested positive. They did not report the cases, even though they should have. And I'm just wondering how widespread that is, and maybe some of these fully vaccinated people also have the fake vaccination cards, which we also know is a problem in this province. So just wanted some comments on that.
Yeah, that is a very, very difficult topic that you're bringing up. One of the concerns that we do have is that the number of specimens that are actually coming through the door for us to test have been dropping over the last few weeks. And our positivity rates, depending on the day, could stay in that 5 to 10% range. Many days it's around 10%. And so one of the things that we're unsure of is the virus really going away, or are people not showing up to get tested? Because if you identify that, you have symptoms, then you're going to be required to go into isolation and quarantine. And And so it's a disturbing thought to think that we have people out there who may know they're positive and not restrict themselves in terms of contact with others where they may spread the virus. And I think that is a concern. How widespread it is, I simply can't tell you. I don't know that data. And how widespread sort of fake vaccination cards might be, I can't tell you that. I don't know that data either. But I do know, because I have my proof of vaccine on my phone, I do know that more and more and more places are requiring you to produce that, and you have to have the electronic copy. So I'm hoping that because you have this requirement for the electronic copy, those are all legitimate.
Yeah. I think, though, to Keith's point, we're seeing a number. We're seeing the numbers of infections drop, but we're also seeing the number of tests drop. Is that coincidental, or is that causational?
I don't know. I think that we need a little bit more time to understand this particular trend. We're also, though, at the same time, Garth, recognizing that we're still seeing a lot of people in hospital. Again, those numbers have dropped, which is very, very positive. And we're still seeing a lot of individuals being admitted to the intensive care unit. Once again, those numbers are improving a little bit as well. And, there are some folks who feel that monitoring admission to the hospital, monitoring admission to the intensive care unit is the real sign as to whether or not the pandemic, the numbers are improving. Because if you're in the community and you're positive, but you don't tell anybody, but you subsequently become ill and require hospitalization, you're then picked up at that point in time. So I still think we need a little bit more time to understand whether or not the downward trend we're seeing is because the situation with the virus is just getting better, or is part of that because people are hiding results? And I can't tell you the difference between those two things right now.
Okay, our next caller is Lana in Saskatoon. Hi, Lana.
Hello, thanks for taking my call. My question actually is related to those home tests as well. So I was at Market Mall a couple of weeks ago. They were handing out these home tests. I thought, okay, I guess I should pick up one of these free home tests, which I did. I got home and I thought, when would I actually use it and why? Because if I have a sniffle and I test negative, I still should be staying home based on what we're being told by health experts. If it tests positive, I still need to be staying home. So I'm not really sure. I think of how much money has been spent on all these home tests and free distribution across the country. And I'm wondering, is this just to provide false sense of security, or what was the purpose of these tests?
No, I really thank you for calling in and raising this issue. It gives me an opportunity to address a couple of things with your question. First of all, I absolutely think it's important to know whether you're positive for COVID or not, because we know that COVID has been responsible for an awful lot of deaths, not only in this province but across the country, and we know that vulnerable populations are at the greatest risk. So we know that, and so knowing you have COVID versus something else, I think is still important. But where life gets complicated for us now is we screen for other viruses as well. And so we've now detected other respiratory viruses that are circulating in the province. And these names won't mean much to a lot of people, but RSV and parainfluenza and rhinovirus. Rhinovirus is the number one cause of the common cold. And coronavirus, not COVID, but the seasonal coronavirus is the number 2 cause of the common cold. So your question is right. You could test negative and still have the sniffles, but it could be for a different virus. But if you had the sniffles and you tested positive for COVID, I still think that that's very, very helpful. And then reporting that to public health in case any contact tracing needs to be done, I think remains an important part of the strategy to deal with COVID in this particular province. So I personally don't see this as a waste of money. I do not see it as a useless exercise. And I think it's going to become more important as we move forward and we see some of these other respiratory viruses continue to spread in the community.
Okay, Lana?
That's great. Thanks so much.
Okay, thanks for the call.
Thank you very much. Okay, take care. Bye-bye.
Volodymyr is on the line in Saskatoon. Hello, Volodymyr.
Hello. I have a question for doctor. Myocarditis is a rare condition, yes. In
Yes.
boys or particularly teenagers. I understand before this year, never hear of this condition. Very rare. I'm told still very rare. yet suddenly the condition affecting young boys, including my son, who got the vaccine in June, he and two of his friends have myocarditis now. I want to understand why healthy young boys encouraged to take vaccine and are now suffering for it. They cannot play sports. They are missing school. We're in and out of doctors. Doctors don't understand what's going on. I understand. If they didn't get this jab, they would not have this problem. I want to know why myocarditis is suddenly a problem now.
So myocarditis and pericarditis are not new entities. These are associated with viral infections. And there are viruses called Coxsackie virus that are associated with this particular condition, and there are others as well. And yes, it is a rare entity, but it is not an entity that's only described associated with the messenger RNA COVID vaccines. We deal with cases of diagnosis of myocarditis or pericarditis more often than you might think, even though it is a rare condition. And again, they've been described decades and decades and decades ago and continue to be so. And it's certainly not just related to COVID-19, and it's not related to the vaccine. I think it's very, very unfortunate for your son and his friend to have this. And certainly if it's associated with the vaccine, that's very, very unfortunate indeed. But they have been described as being associated with vaccine in a very, very small number of individuals. But I think we need to be careful to differentiate between COVID-19 and pericarditis as a consequence or potential side effect of the vaccine versus myocarditis or pericarditis caused by other viruses, which we have recognized for decades.
Yeah, do we have any idea?
Answer my question. And you're pushing medicine on children.
Okay. Do we have any idea why this myocarditis seems to, and while rare, as the caller mentioned, it seems to affect young, healthy boys in particular? Any idea? Do we have any idea why that is?
No, we've been looking. There's been a number of papers that have come out trying to explain what might be the mechanism of this, but I don't know that anybody has a firm explanation at this point in time. The good side of it is that it tends to be reversible with time, and so in most, if not all, patients, I don't know. I don't have the figures, Garth, as to how many, if any, people died as a result of myocarditis or pericarditis associated with the immunization. But I do know in the majority of people, they get better from this. I do know one adult patient that is known to us that actually had this complication after vaccination as well. So again, I can't give you an explanation because I'm not sure it yet exists.
Is myo or pericarditis, is that one of the, can that be caused by COVID itself?
Yeah, you can have heart involvement with this virus as well. Yes.
Okay, we're going to take one more call and then a quick break for a news update. Jerry is on the line in Saskatoon. Hi, Jerry.
Hi, Garth. And thank you for having Dr. Blondeau back again. Dr. Blondeau, thank you for taking the time to explain things to us throughout this pandemic and for having the courage to say you don't know when you don't know rather than glossing things over. I have a question about the booster dose. My husband and I are soon going to be eligible for the boosters. The booster, is it a full dose or is it a partial dose of the vaccine?
You know what? Great question. My understanding, it's a full dose. I don't think it's a partial dose. And the rationale behind it is to get your level of protective antibody back up to a certain point to make sure that if you encounter the virus, that you have a level of protection which is seem to be important even with the variants of concern that are circulating. So I don't believe it's a partial dose. I believe it's a full dose. Okay, great. Thank you so much. I appreciate that. You're welcome.
I'm assuming now that all these booster shots will be mRNA.
I believe so. I don't know whether or not the AstraZeneca vaccine is an option. I don't know that as a fact. I don't think so, but I think it's going to be the mRNA vaccines.
Okay. If you're just joining us, folks, our guest today
Hello, I'm Tori Gillis here for your news update. Right now it is 12:30, and here's what's coming up in our 1 o'clock news. Well, it's moving day at Camp Hope. Now, that's the tent city in Regina's Pepsi Park, and it's been housing people who are struggling with homelessness. This morning, residents of that camp began a transfer to an indoor facility. Now, what we know is the camp was set up back in October as a place for people who are experiencing homelessness to go, and so far about 20 people who are living at that camp, so mostly elders and people with disabilities, have been bused to a new indoor shelter in the Warehouse District. But we're also hearing that there are some folks who want to stay behind, worried about many things, contracting COVID-19 for one in close quarters, to missing out on the community that the camp has brought them. But camp organizers and police are working with the people who want to stay put. And we'll have more details on that coming up in your news. Also coming up, Regina police have charged a 15-year-old boy in connection with the death of a teenaged girl earlier this month. That case started November 1st when police were called to the 1200 block of Ray Street. 16-year-old Katie Burns was found dead outside that house. Now, police eventually arrested that suspect last Friday. They're now just informing the public. He's been charged with second-degree murder, but he won't be named because he's underage, and we've learned that he appeared in court this morning. Also coming up in your news, restaurants in Saskatchewan are now able to sell alcohol for delivery and takeout. They must have a valid liquor permit to do that. Now, it's supposed to make it easier on businesses hit hard by the pandemic. Alcohol must be sold with a food order, and it can't have retail displays or in-location shopping. Retail stores also now allowed to deliver alcohol to homes without applying for a special limit. So we'll also have that story coming up in your news right here at 1 o'clock.
Thank you, Tori Gillis. This is the Blue Sky producer, Abby Schneider. We're having some tech issues. There clearly is something with that Saskatoon studio, and I can see Garth on the monitor, and we will get the tech people fixing that right away. But while we wait, we do have some questions. We got one from Facebook for Dr. Blondeau. Thanks for joining us. Jer asks on Facebook, is the booster dose of COVID, aka your third shot, is it a necessity?
So, you know, I can't answer that question directly because I don't think anybody can. This is really about trying to protect the population by ensuring that you have a minimum level of antibody that's deemed to be protective in the event that you're exposed to the virus. Now, if you're re-exposed to the virus, your body will naturally form what's called a booster or an amnestic response, meaning that it will respond faster to the same antigen to which you developed antibodies to. And that generally occurs much quicker than the time it takes for you to raise antibody after you say you've been immunized or infected for the first time. So this is really about essential is very, very difficult to define in the context of the booster. But is it a measure that would help reduce the likelihood that you become severely infected in the event that you're re-exposed to the virus? Then the answer to that is yes. Having a higher level of antibody does protect you even when it comes to the variants. And I think it's for that reason that it's being proactive as opposed to reactive.
And I think we've reached Garth. Garth, are you connected with us now?
I hope so.
Fantastic. Over
Okay,
to you,
great.
sir.
Thanks very much, Abby. If you're just joining us, of course, our guest is Dr. Joseph Blondeau, head of microbiology at Saskatoon's Royal University Hospital. If you have a question about COVID-19, the vaccines, long COVID, give us a call right now. Again, it's 1-800-716-2221. You can email bluesky@cbc.ca or reach us on Twitter @blueskycbc. And we're live streaming today's program on the CBC Saskatchewan and CBC Saskatoon Facebook pages. So you can ask your question in the comment section there, and we'll get to them as quickly as we can. Let's go back to the phone lines. James is in Saskatoon. Hi, James.
Hi, Garth. Hi, Dr. Blondeau.
Hello.
This is I guess, a male-related question. Now, you were talking about heart conditions that came from the vaccine, but also from the disease. And I believe that it's something called endothelial tissue that's affected by COVID. And that is also the erectile tissue for men. Now, and I've read reports where they say that anyone who is hospitalized with COVID has a 6% or a 6-time increase in the possibility of erectile dysfunction. Now, should people be concerned about their reproductive ability because of this?
I can't answer that question. I've not read in that particular literature. It was not something that I'd been previously asked about, so I didn't. I'm unfamiliar with that literature in regards to erectile dysfunction. So you kind of stumped me. But I mean, if it is a concern, then obviously it would be a concern for anybody that's potentially susceptible to infection with COVID, and for which it could be a problem going forward. But I'm sorry, I can't answer it because I just don't have that data.
Okay, maybe we can arrange an answer for you next time Dr. Blondeau's with us now that he's got a heads up.
Okay.
Yep.
Dr. Blondeau, we got this question last time you were on. We weren't able to fit it on the show. And Leah wants to know about long-haul COVID. She wants to know, how often is it happening? What does it look like?
So I'm going to tell you, Garth, I'm just going to grab some. So let me tell you about a study that was done in the United Kingdom that addresses this. They looked at 1.1 million people in the United Kingdom that had long COVID-19 symptoms. And the symptoms were overall lasted for more than 4 weeks. Two-thirds of the symptoms, or in two-thirds symptoms lasted for longer than 12 weeks. And 20% of those individuals that had what was defined as long COVID said that they had their daily activities affected. And just to remind the listeners that the symptoms of long COVID could be anything from fatigue, breathlessness, anxiety or depression. You may feel heart palpitations, chest pain. You might feel muscle and joint pain. And then one of the ones that a lot of people have complained about is this concept of brain fog, where things that you've known for all of your life you can no longer remember. I believe there was a lady on CBC the other day talking about her experiences, saying that she couldn't remember the word pen and had to say to her partner, "Can you please pass me that thing that you write with?" And so people have had to relearn some of these things. And there's also a distortion in sense and smell. But to answer the question fully, there was a study of 1,000 patients in the United Kingdom that were hospitalized for COVID. And 70% of those patients were not recovered 5 months after they got out of hospital. And 20% were considered to have a new disability. Almost about 18% were no longer working but had been working prior to COVID. And 20% had a health-related change to work to accommodate their disability. So the answer to the question is, it's not an uncommon condition, and the range or the spectrum of what happens to people varies. It's not the same in every individual person, and it really can be quite debilitating in a number of different patients and for a long period of time. So my message is, you really want to avoid catching COVID because you don't want to be a person that fits into this category of being a long hauler.
And Leah also had a follow-up. She wants to know if it has been seen or if it's a concern in children.
I don't have the data set for children the same as I do for adults. So I can't answer that one with certainty. I believe there has been some descriptions, but not to the same extent that it's been characterized in adults. But I will look.
Okay. We got a question on Facebook from Angel, pretty straightforward. She wants to know if there are metals in the vaccine.
Metals? I don't recall metals.
Okay, Angel, if you check our Facebook page, we're going to post a link to Health Canada, and that link connects with a list of all the ingredients in all of the approved vaccines. So, Angel, if you just stand by, we'll post that in the comments section right away quick. And let's go back to the phone line. Stefan is on the line in Saskatoon. Hi, Stefan.
Hi, how's it going, Garth? And thanks, Dr. Blondeau. You've been a beacon of knowledge, and I just really appreciate that. I want to say that quick. I have a question.
Very kind.
I am a few months out of my booster shot eligibility, but I'm also wondering about the flu shot. And when I obviously I want to go get it, but I just don't want to. Is there any combination risks? And if I were to get the flu shot any day now, would it have any adverse reactions, or should I be cautious about anything in regards to the booster down the road?
No, no, there's no contraindication. That's been put out now. You see that on a number of different platforms. You don't have to worry about getting one and then it affecting the other. So not a concern.
Great. I appreciate it. Thanks again, you guys.
All right. Thanks, Stefan.
So
got
Gareth,
a note here. Go ahead.
Just wanted to say one report I just pulled up suggesting that there about half of children who contracted COVID may have some lasting symptoms, some of which would be considered to fit into the long COVID. I don't know the pediatric literature as well as I should, but so the answer to the question would be yes. Children can have long COVID as well.
Got a note here from Dorothy on Facebook. Dorothy writes, we've already had 3 shots, 1 AstraZeneca, 2 Pfizers. Are we going to be eligible for a 3rd Pfizer shot?
I don't know the answer to that question.
Fair enough.
I will find out and I will get back to you. I don't know.
Okay. Be interesting to get a little more information from Dorothy. Maybe, Dorothy, if you're still listening, maybe just give us a quick idea of why you've got 3 shots already, because that's uncommon. So if you could do that, Dorothy, maybe that'd help. All right, let's go back to the phone line. Steve is in Moose Jaw. Hi, Steve.
Hey, how's it going?
Pretty well, thanks. Go ahead, Steve.
Okay, so I have a question for the doctor here. I work for a large organization, and I'm tracking basically a number of side effects from the vaccines, in this case mRNA, including facial paralysis, myocarditis, neurological damage, kind of similar to Guillain-Barré, heavy bleeding in women, migraines, premature ventricular contractions with the heart, and shingles. This is just some of the side effects I've tracked from people I know.
Okay, no question there. Let's move on to, I believe it's Cerise in Regina. Cerise in Regina. Hi, go ahead.
Hi, good afternoon. Dr. Blondeau, there's a question I've been really getting concerned about. On the local news every day, they give the percentages of people who are showing positive. And I'm wondering, why is the double vaccinated percentage so high? And the people that are, and I'm double vaccinated waiting for my booster, but why are so many double vaccinated showing a positive reaction, and are they quite a high percentage of them being hospitalized, or is there some way of knowing, are they usually recovering on their own at home?
So your question is a very, very complicated question, so I'll try and tease it apart. It is possible, because we have evidence both in Canada and the United States and elsewhere in the world, that if you're double vaccinated, you can be re-exposed to the virus and you can be mildly infected. Some may not even recognize that they're infected and be asymptomatic. Others could be mildly symptomatic, and then others still could maybe be unfortunate enough to have a more severe infection. Now, depending on how you're tested and when you were tested, in reference to when you were previously positive, that could confuse things as well. So if you have a PCR test or a nucleic acid amplification test, we know that a person could remain positive by that test for up to 3 months after they've had infection with the virus. But you're probably only picking up remnants of viral RNA. You're not picking up live virus. So that's one possible explanation. The other possible explanation is that we're simply picking up breakthrough infections in individuals who are double vaccinated, but who are not likely to progress to have more serious infection. And so that means that the vaccine is doing what it's supposed to do. So I kind of hope that answers your question, because that's the explanation I have for you.
Well, it does, but what exactly is a breakthrough? I keep hearing the term, but I don't exactly know what that means.
Okay, I'd like to repeat a data set that came out from the United States, which demonstrates this. So the Americans, through the Centers for Disease Control, released data on 181 million vaccinated Americans. Out of that data set from 50 U.S. states, they were able to detect about 19,500 patients who were double vaccinated who tested positive for COVID and required hospitalization. So that's 19,500 out of 181 million.
Mm-hmm.
Of that 19,500, about 14,500 did not die. So they successfully were released from the hospital. But about 4,400 of those patients died, of which 800 died for reasons other than COVID. Say they were in an automobile accident and they tested positive, but they didn't die because of their COVID, which meant that about 3,600 patients out of 181 million, even though they were vaccinated, contracted COVID and subsequently died. And when you break down that data, more than 85% of those patients were greater than 65 years of age and had some other underlying medical condition. So what does that tell us? It tells us even though you're double vaccinated, you could still be an individual which is at risk, and most often it's going to be defined by age and some underlying medical condition, which is why I've continued over the course of the pandemic to say, even though you're immunized, you should still be practicing other safe practices like wearing a mask, minimizing the size of your social bubble, particularly if you're unsure of the vaccine status of the individuals in it, maintaining distancing, hand washing, and whatnot, because the vaccines are not 100% effective. They're really good, or amongst some of the highest effectiveness of the vaccines that we have, but not 100%. So does that help you?
Yes, that helps a lot. I really appreciate your information, and I'll continue to listen. Thank you so very much.
You're most
Thanks,
welcome.
Therese. Got an email from Ellen, and it being a Monday, this is probably a question that we'll get a lot. Ellen writes, when should I use the rapid test after a potential exposure to catch an asymptomatic COVID infection? My kid was in a rink locker room all weekend, so wondering when the best time after that to use the rapid test.
I would say that you would probably want to use it, probably within 48 to 72 hours. And then if it's negative, but you're still concerned, you can repeat it again in another 48 hours. There's no hard and fast rule here. But if you test too early, you might not pick it up. If the person has been exposed, but if you give it a couple of days and then test it, but if you're still concerned, then retest it again another couple, then that should give you some reassurance.
So in Ellen's case, today, tomorrow, Wednesday at the latest.
Yep.
Okay. Hope that helps, Ellen. Let's go to the phone lines where Josh is in Regina. Hi, Josh.
Hi. Thanks for taking my call. I'm a registered nurse. I've been double vaccinated since January or so. In October, I got quite sick with COVID, and I'm better now, but I'm wondering if I should hold off on getting my booster or should pursue that right away, or if I have good immunity for another couple of months.
The booster is available, based on my understanding, 6 months after your last immunization. And the one thing that we don't know, at least to the degree that we need to, is if you were exposed again, because we don't have a good antibody test that tells us this, it might be that your antibody level following exposure might not be as robust as your antibody response after vaccination. So if it was me, and I'm giving this from a personal point of view, I would take the booster shot when I'm eligible.
I haven't had a chance yet, and I wondered if there was anything that you might know. But thank you very much.
Yeah. Okay.
Got an email here from Terry. Terry writes, I had COVID at the very beginning and still have long-haul effects. I've had 2 AstraZeneca shots and 2 Pfizer shots. Is there a need for me to get a booster?
I just text to one of the vaccination folks, and they didn't answer that question. Okay. I will have to check that, Garth, and find out, because I don't want to say a blanket yes. I think the answer is yes, but I'd rather confirm that first before I say it.
Okay. We got a follow-up here from Dorothy. Now, Dorothy was the one that wondered about a booster when they've already had 3 shots.
Yep.
And here's sort of the backstory to that is we got a 3rd shot, which was Pfizer in August, when the province invited people who had mixed AstraZeneca with the Pfizer shot earlier in the year.
Yep.
So that's why she had the 3rd. Do you think she'll need a 4th?
The response I got back to the question was that if you've had 2 AstraZenecas, then as of this Friday, you can get a booster at 6 months, but I don't know about a second booster. Garth, I'm going to have to get clarity on these questions so I don't mislead people.
Okay.
So I'll go right to the top of the food chain to get that answer.
Okay, well, we appreciate that. Okay, we got a question on Facebook from Ian who writes, could Dr. Blondeau comment on the new Pfizer COVID-19 pill? I think it'll be of great benefit to developing countries that don't have the facilities to store the vaccine or the medical staff to deliver the vaccines. Just how big a deal is the Pfizer, and I think Moderna has one too now in the process. How big a deal are these antiviral medications?
So there are 2, Garth. Merck has one called Molnupiravir. We've talked about that before. And what Molnupiravir is a nucleoside analog drug, and it was shown in clinical trials to reduce hospitalization by 50%. And that study was ended earlier by an independent oversight committee that thought it was unethical to continue it because of what appeared to be a proven benefit. The same thing has happened with Pfizer's pill. It's called Paxlovid. And this is actually a combination of 2 molecules, if you will. One of these, so when a virus makes, or when it replicates its nucleic acid, you then need enzymes to come along and cut it in certain places in order to continue with the process to make it an active protein. Or the right size nucleic acid for viral replication. So the Pfizer drug actually prevents the enzyme from making those cuts. But there are other degradative enzymes within the body that would destroy that particular compound. So the Pfizer drug is going to be packaged with another drug called Retanovir. And what Retanovir does is it blocks the enzymes from degrading the active drug, which prevents the nucleic acid from being cut. And what that data has shown was that if you gave the drug within 3 days of the onset of symptoms, it reduced hospitalization and progression to severe disease by 89%. And if it was within 5 days, it was reduced by 85%. So long explanation, but the question is this a game changer? All of the expert groups seem to say yes. And the reason being is because it is probably much easier to distribute than the vaccine, particularly vaccines that require ultra-low storage. And pills are always more easier to administer than our intravenous drugs or our needles for immunization. And so it could be a real game changer in regards to the developing world that have poor access to vaccines but might have an easier time distributing these medications.
All right. Okay, and we got a question from Nadine on Facebook. Nadine writes, and she tells us that this is just pure curiosity. If one is fully vaccinated, is there any way to know if one did encounter COVID? Would you be able to tell if your immune system did indeed fight off the infection?
You would if we were able to capture, you being positive, and then if we had a good antibody measurement to actually look and see how your body responded, then it would be positive. It would be possible. But what I would say was that if you were double vaccinated and you became symptomatic and you were proven to have COVID and then you got better, then you would know, of course, that either your antibodies, whether through natural infection or through vaccination, actually worked.
Right. The weather is turning. We're expecting a storm tomorrow, and, winter is here. How concerned are you about our numbers now that we're going to be spending more time indoors and less time out and about?
Garth, I'm still really, really concerned. We still have a substantial percentage of the population who are unvaccinated, and we don't have a firm handle on what percentage of those individuals might have been naturally infected and have some level of we simply don't. And what that means is that even if you had 10% of the population that were unvaccinated and susceptible, in a province of this size, that's more than 100,000 people, and that's still a lot of individuals that could become infected. And so the closer we come together, particularly with the Delta variant indoors, higher viral loads, higher transmissibility, then the risks that we could see a resurgence in cases, I think, is very, very real. And for that reason, I'm very concerned.
Yeah. It would appear at this point unlikely that we're going to break much past the 80% eligible people vaccinated.
That would depend on what happens with the kids between 5 and 11, because they do represent a percentage of the currently ineligible population, but they will become eligible if the vaccine is approved, and they may be enough to get us up to closer to that 90%, but that will remain to be seen.
All right. Remember, Angel asked about metals in vaccine, and she has a follow-up here. She writes, as someone who is very allergic to caffeine, metals, and shelf pills like aspirin and Tylenol, I'm very scared to take the shot as I have very bad reactions to normal drugs. I also get a lot of bacterial infections because I have diabetes. Would you suggest I take the shot?
What I would suggest is that you call and ask to speak to one of the medical health officers who are absolutely versed in what they've experienced with individuals in regards to response to the vaccine, side effects and whatnot, and actually get a very informed opinion about what's the probability that you might have a problem with the vaccine or not, and then follow their advice. I think they're the best people to answer that question.
We talked about how big a game changer the antiviral pills might be. How big a game changer might it be if we do reach that 90% of people vaccinated once the kids are eligible?
Back months and months and months ago, I think somebody asked me the question, was this all going to be over? And I stupidly said yes, thinking that this was going to run its course and be done. And the one thing that we don't know, Garth, is even amongst the vaccinated population, will there still be enough spread of the virus to keep the virus circulating? And so if that's the case, if that was to happen, then is 90% the right number? I don't know. Maybe it'll need to be a little bit higher. But I think as a starting point, we certainly need to get that 90% because 80% doesn't appear to be doing it. And whether or not this virus becomes part, at least for the next few years, of our annual immunization campaign is anybody's guess at this point in time. Hard to make a prediction because the virus has fooled us a few times over the course of the pandemic.
Right. All right, Dr. Blondeau, thanks for your help again today, sir.
It's my pleasure, and I will follow up on those immunization questions, and I'll send you a note so that we can get the right information out to those people that had these unanswered questions.
I appreciate that. Thanks again, sir.
It's my pleasure. Be safe all. Thank you.
Dr. Joseph Blondeau is head of microbiology at Saskatoon's Royal University Hospital. He also teaches about infectious disease at the University of Saskatchewan. Now, tomorrow we will appropriately be talking about shoveling snow, who should be in charge of clearing walkways, what should be the penalty if you don't clear the walk in an appropriate amount of time, and what is an appropriate amount of time. And now that both Regina and Saskatoon have bylaws saying you must shovel the city sidewalk, what do you think of that? That's tomorrow's conversation here on Blue Sky. Hope you can join us then. Have a great afternoon, folks, and we'll chat a little later. Bye now.